After you take drugs, they enter into your bloodstream. There, they are distributed throughout your entire body. Drug distribution is determined by three major factors: blood flow to tissues, the ability of a drug to exit the vascular system, and the ability of a drug to enter cells. First, drugs are carried by the blood to the tissues and organs of the body. The rate at which drugs are delivered to a particular tissue is determined by perfusion of blood flow to the target organs or tissues. Let's talk about the blood-brain barrier. This refers to the unique anatomy of capillaries in the central nervous system. There are tight junctions between the cells that are so tight that they prevent drug passage. Only drugs that are lipid-soluble or have a transport system can cross the blood-brain barrier. Exiting the vascular system is necessary for drugs to undergo metabolism and excretion. Drugs in the vascular system exit the blood through pores in the capillary wall.
During pregnancy, special considerations must be made because drugs can cross from the maternal bloodstream through the placenta and into the fetal bloodstream. Lipid-soluble, non-ionized compounds are able to pass from mother to fetus via the placenta. This is important because some substances that are able to cross the placenta can adversely affect fetal growth and development. The first trimester is the most sensitive time for this because fetal organs are developing at this time. Alcohol, ingredients in cigarette smoke, caffeine, and illicit drugs can also transfer to the fetus from the maternal bloodstream via the placenta. While caring for your pregnant patients, you actually have two patients, so remember to use the lowest therapeutic dose for the shortest duration to best avoid fetal risks.
An important aspect of the distribution phase is protein binding, which can affect a drug's performance and ability to reach its intended site of action. Drugs can form reversible bonds with proteins and may be a bound drug or an unbound free drug. The ability of a drug to bind to a protein depends on attraction. Albumin and warfarin have a strong attraction, whereas gentamicin has a weak attraction. In this scenario, there are more free gentamicin molecules compared to warfarin molecules. It is important to note that protein binding can restrict drug distribution. This visual illustrates how a drug, the package, binds to albumin, bubble wrap, and will not be able to leave the bloodstream, whereas a drug not bound to albumin will better be able to leave the bloodstream. Finally, distribution also depends on the drug's ability to enter cells. While some drugs bind with external receptors on a cell membrane in order to produce the desired effect, others must cross the cell membrane.